What is rheumatoid factor, RF, in raw blood tests? Imagine a tiny protein in your blood that can tell doctors a lot about what's happening inside your joints and immune system. That protein is called rheumatoid factor, or RF for short. It's a special kind of antibody, which is a protein your immune system makes to fight off infections. But in rheumatoid arthritis, RF is an autoantibody, meaning it mistakenly targets your own body's tissues instead of foreign invaders. Specifically, RF attacks a part of other antibodies called immunoglobulin G. This attack can cause inflammation and damage, especially in the joints, leading to pain, swelling, and stiffness. When doctors want to understand if someone might have rheumatoid arthritis, they often order a blood test to measure the level of rheumatoid factor. The test results show how much of this antibody is in your blood, usually reported as units per milliliter or as a titer. Most labs consider a level below 15 to 20 units per milliliter as normal or negative. If the level is higher, it's called a positive result. But a positive RF doesn't automatically mean you have rheumatoid arthritis. It's just one piece of the puzzle. About 70 to 80% of people with rheumatoid arthritis have a positive RF test, but that also means some people with RA may not have elevated RF levels. Plus, some healthy people, especially older adults, can have detectable RF levels without any disease. Elevated RF can also show up in other autoimmune diseases like Sjogren's syndrome or lupus, or in chronic infections. So, while a high RF level can support a diagnosis of RA, it's not definitive on its own. Doctors don't rely solely on RF results. They look at your symptoms, medical history, and other tests. For example, they might check for anticyclic citrullinated peptide antibodies, which are more specific for rheumatoid arthritis. Imaging tests like X-rays can also help see joint damage. The key is that RF is just one part of a comprehensive evaluation. It's important to remember that a negative RF test doesn't rule out rheumatoid arthritis. Some people with RA never develop detectable RF levels. Conversely, a positive RF doesn't mean you definitely have RA. That's why healthcare professionals interpret these results carefully, considering all aspects of your health. Early diagnosis and treatment are essential to prevent joint damage and improve quality of life. Always discuss your blood test results with your doctor. They can explain what your specific levels mean and guide you through the next steps. Remember, each person's experience with rheumatoid arthritis is unique, and diagnosis involves a combination of blood tests, symptoms, and sometimes imaging. Trust your healthcare team to provide personalized advice based on the most current and reliable medical information.